Welcome to Ask the Expert, North Texas, here on News Radio 1080 KRLD. I'm David Rankin.
And I'm Kristen Diaz. So Curative, a Texas-based leader in the employer-sponsored healthcare space, they recently announced a staggering new study of the Dallas-Fort Worth area. It shows 51% of insured residents are unable to pay out-of-pocket healthcare costs. And then on top of that, 48% weren't able to adhere to their prescribed medications because of those costs, despite having health insurance. Here to discuss the study further is Curative CEO Fred Turner. He's on today's Ask the Expert. Thanks so much for the time.
Yeah, thanks for having me on.
Yeah, so when you guys started this study, what were some of the factors that you took into consideration?
Yeah, we've really seen a dramatic increase over the last 10 or 15 years in these high deductible health plans and trying to shift the cost of healthcare onto the member rather than the insurance company. And we strongly believe at Curative that this is one of the driving forces behind an increase in negative outcomes. And we wanted to understand the effect this was having on real people who are covered by employer-sponsored health insurance and the affordability challenges that they're facing.
Isn't it a big surprise that it's gone up so high in the last 10 years?
The reason it's gone up is increasing patient cost sharing. It's a very effective way of saving money in the short term. So if you just look on a 12-month basis, if you increase people's deductibles and cost sharing, they stop going to the doctor. And that saves money on a 12-month cycle. The problem is if you start looking further out, all of that care that you put off in that first year, it could have been a primary care visit to manage prediabetes. Now that's going to show up in the second, third, fourth year as diabetic that's unmanaged showing up in the emergency room. So what could have been very low cost preventative care, by deferring it in that first year, you're basically paying significant interest on it by putting it off to a higher acuity setting. So it's this lack of investment in preventative care that's really driven this.
And, what percentage of these employers were you taking into consideration as well? Were these huge companies or smaller businesses?
So this was a whole mix. The survey was done online with employees responding individually. So it was a whole mix of DFW area employers.
Let's talk about the fact that beyond the out-of-pocket is almost half of people didn't take their medications. And again, as you're talking about, delaying things down the road, if you're not taking your medications, chances are you're going to get even sicker and then add on even more costs on the back end.
Yeah, it's when you put in place these barriers to care, right? It's difficult enough to keep up with these things as a patient anyway, if you're having to take multiple medications per day. Once you start putting additional barriers in place of, you have to pay $50 to fill it here, and it's your deductible up to this, and then 25% after that. All of this complexity, it just creates barriers, and it gives people another reason to put off taking it. And we've found in our plans that have no copays and no deductibles, we get up to 90% adherence, where you're seeing the average be about 50%. So when you start removing those barriers for people, make it easier for them to actually adhere, people do want to. But when you look at these plans, that 50% adherence, that's saving that insurance company money this year because they're not having to pay for those drugs on the people who aren't adhering. Long term, like you say, that leads to significant health problems for those individuals that really should be dealt with preventatively upfront.
No, 1,000%. And do you think employees really understand the market? Are they educationally, is it easy to understand? Is the market doing itself a favor right now? Because I think a lot of people go through their sign up at their job and, they may offer some, employee benefits, and they're just click. And then it'll ask you, do you want additional insurance? And you're thinking, well, shouldn't this cover everything? What do I need additional insurance for? What's the delay there, you think?
Yeah, I think the industry has kind of been built on making it so complex that people don't understand. Right. I think that's one of the techniques and tactics that some of the larger insurance companies have taken to make it so complex to receive care that people just get stuck and don't even bother trying. And again, it hits the preventative care hardest, which downstream is going to, you're going to see that in increased hospitalizations, increased chronic disease. And we really think you have to do that education up front. So what we do as part of the curative plan is every member has to do a baseline visit. And it's a 1 hour visit, one-on-one. You have 30 minutes with a care navigator, and they explain the plan. They explain how to access care. What does a copay mean? What does a deductible mean? What does in-network mean? All of these confusing terms that the industry's come up with. Like, how do you actually go see a doctor? And they walk you through it. They help you sign up for the telemedicine. They help you figure out how to use the pharmacy. And we found when you kind of kick off the health plan in that much more collaborative way, that we're here to help you engage in preventative care. We actually want you to get care, rather than the insurance company kind of being the barrier to block care, that members really want to engage. People want to go and do that preventative service if it's easy, because people are busy. It has to be easy. It has to be simple. It has to fit into their life.
You mentioned in this study, 51% in the Dallas-Fort Worth area can't pay out-of-pocket expenses. How does that compare to other areas of the country? Did you specifically look at the DFW area?
So we did it in 4 different Texas metros. I think this DFW was the highest, but it's in that 40 to 50% range in Austin, San Antonio, and Houston as well.
And have you heard feedback from employees or even employers? Because I feel like even like small business employers, they also get overwhelmed with what they need to be offering, the best benefits, because everything is so competitive right now. And you have employers that are just here one day, they're gone the next. And how do you work with employers specifically to retain their employees with these benefits?
Yeah, I think employers really value simplicity, and it has gotten to the point where it's so complex. You have these like 5 tiers of plan with all of these co-insurance, co-pay. Like, there's so much stuff going on that it just gets overwhelming. And employers have so much to deal with in just trying to attract and manage their talent pools. Having these very complex plans just makes that even harder. And it makes it hard to explain. If you're trying to hire an employee and you're explaining we have the PPO and the EPO, and it just goes
the
over
whole alphabet.
Right. And so people just don't get it. And so I think we've got to kind of get back to basics of giving people great coverage where they actually feel comfortable that if they need to see a doctor and when they need to see a doctor, they're going to be covered and they're going to be able to afford it. Those are the kind of benefits that allow employers to actually attract and retain talent.
How much cooperation do you actually receive from the medical community, and how much cooperation would you like to see received from the medical community in this?
Yeah, I think we've seen a great response from the physician community, because they are kind of caught up in the middle of this. They really want to just be seeing patients, providing great quality care, but instead they're chasing patients down for copays. And they're in these situations where a patient might not come back because they know that they owe the doctor a $50 copay from the last visit. So they skip the next visit because they're going to get chased for that bill. And that's not what, doctors went to med school to do. It wasn't to chase patients around for copays or to figure out how much of the deductible is left. And so getting to this point where you can get rid of that cost sharing, and the insurance is the one paying, the doctor is the one providing care, and they're not chasing people around for copays, really simplifies their job and their focus. And it makes the experience in delivering care much easier for them. So we've seen a really great response from the physician community. I think we're also seeing a really good response from employers, but there is a lot of momentum in the employer space and just kind of keeping doing what they've been doing and complaining about the 20% increase in premiums every year, but expecting that you'll get a different result if you keep doing the same thing. Is you gotta change something, right? If we want to see
definition of insanity.
Yeah. Well, thank you so much for opening our eyes with this study that your company did. Was there anything else you wanted our listeners to know about these healthcare costs?
I think just that it is possible to have health coverage without having such a high out-of-pocket cost. It's been proven in other countries. It's been proven in pockets in the US. It's how the US system used to work. And I think we can get back to a system where patients are not burdened with such high out-of-pocket costs to still receive great medical care.
That is Curative CEO Fred Turner on the KRLD Afternoon News. Ask the Expert. Thank you so much for your time.
Thank you.